Hello everyone! Have you ever seen somebody around you who loves and cares about himself so much? For example, prince or princess disease. Or have you ever heard about the term narcissism or been labeled as a narcissist by someone? It's good to cherish and love yourself, but it's a problem to love yourself too much. Well, narcissism broadly describes excessive self-involvement and inflated self-image. Hi there, I'm Umair from Cloud Hospital. I'm going to talk to you about a psychological disorder called narcissism. And before you start, please subscribe to our channel so the next time you'll be updated with our new releases. So what is narcissism? According to the Cambridge Dictionary, narcissism is defined as an excessive interest in admiration of one's own physical appearance and/or one's own skills. While narcissism antonym is to be moderate and to avoid indecency or impropriety. Men are more prone to narcissism than women. Narcissism can be a trait or a personality disorder that starts itself in early adulthood. The DSM-5 Diagnostic and Statistical Manual of Mental Disorder defines narcissistic personality disorder, or also known as NPD, as high self-importance and grandiosity, which is evident in both the patient's behavior and fantasy. Patients with NPD typically regard themselves as special, have a lack of empathy, and their behavior in interactions with others is mostly exploitative. The etymology of narcissistic words in Greek mythology. Now, the term narcissism comes from the Greek myth about Narcissus, son of the river god Cephisus. Now, Narcissus was a handsome Greek youth, but kept on breaking the heart of all female he met. Echo was one among many of whom had fallen a victim of Narcissus' beauty. Now, Narcissus rejected the desperate advances of the nymph Echo. This causes Narcissus to fall in love with his own reflection in a pool of water. Narcissus, unable to consummate his love, laid gazing entranced into the water hour after hour, and eventually transformed into the flower that bears his name, the Narcissus. Throughout history, the idea of extreme selfishness has been acknowledged. The concept was known as hubris in ancient Greece. Narcissism has only been described in physiology terms since late 1800s. Now we go to the 5 most often asked questions about narcissism, which are: 1. What are symptoms of narcissism? 2. Types of narcissism, hereditary basis, the difference between a narcissist and a psychopath, and finally, what treatments are available for this condition. Let's begin with symptoms of narcissism. Now, people suffering from narcissism are sometimes referred to as narcissists, but narcissists do not necessarily suffer from a mental disease that can be diagnosed based on symptoms. The following are the most frequent narcissistic symptoms. First is overestimating his or her self-importance and need constant admiration. Second is exaggerating about achievement and skills. Third is constant preoccupation with success, power, and fame. Then there's difficulty maintaining healthy relationships. Then exploitation of others. The person also cannot tolerate criticism, continuous envy of others who already have what they wish for, and also lack of empathy or ability to take responsibility for behaviors. Now I'll go through some types of narcissism. Before you designate somebody as narcissist, keep in mind that there are several forms of narcissism. While they all exhibit the core characteristic of narcissism, they do so through some distinct behaviors that range in intensity and danger. Narcissism manifests itself in a variety of ways. Now, the healthy narcissism, many people exhibit narcissistic tendencies without meeting the criteria for the disorder. To be clinically diagnosed with NDP, a person must display at least 55% of the most frequent symptoms of narcissism according to the DSM-5. Then we have the grandiose narcissism. Mostly represents the broader term of narcissism, since individuals who suffer from it have a continual desire to grandiosely highlight their qualities, such as entitlement and self-obsession. Grandiosity in psychology refers to an inflated sense of superiority. Now, vulnerable narcissism is the opposite of grandiose narcissism. People that suffer from it are typically introverted and unhappy, and they may also be chronically envious and too sensitive to others' people's opinions. Then we will talk about sexual narcissism. It is an exaggerated, egotistical admiration of their own sexual powers. Now, sexual narcissists are obsessed with their sexual performance. Other kinds of narcissism include somatic narcissism, which causes people to be obsessed with their own looks and to believe that they are more attractive and stronger than they are. Cerebral narcissism is the opposite of somatic narcissism in that people who suffer from it overestimate their intellectual abilities. The most dangerous kind of narcissism is malignant narcissism, which is a combination of narcissistic personality disorder, antisocial behaviors, and continuous egocentricity. So you may ask, is narcissism genetic? Since the etiology of narcissistic personality disorder is unknown, genetics may also play a role in contributing in emergence and development narcissistic personality disorder. Moreover, research indicates that having a family history of conditions enhances a person's chances of acquiring this disorder. Next question is the difference between narcissists and psychopaths. Despite the fact that both narcissism and psychopath may have similar traits, people who are narcissistic believe that they are superior and capable of doing anything. But people who are psychopaths do not feel the need of admiration and success. Instead, they feel the urge to commit illegal activities without being caught. Furthermore, a narcissistic person is generally loud and wants all of the focus on him, whereas psychopaths want all the attention to be directed away from them. Finally, is narcissism curable? While a large percentage of patients have improved and recovered after receiving appropriate therapy, narcissistic personality disorder is typically a lifelong illness. Furthermore, some real-life events such as new successes may have a role in narcissism therapy according to specialists. Even though there is no specific treatment for narcissistic personality disorder, some medications such as antidepressants, antipsychotics, and mood stabilizers can help to reduce the symptoms of this disorder. Is narcissism then curable, you may ask? It may be completely curable, but it can be controlled with therapy. So today we talked about narcissism. It is really good to love yourself, but it will be a problem if it's too much. So everyone, you and I should love ourselves from now on, but we should also be careful not to overdo it. Thank you for joining us in yet another video covering key health-related topics with Cloud Hospital TV. If you have any questions or comments, please leave them below and we'll respond to you as soon as possible.